Assalamu alaikum dear doctors. In this video I am discussing about history Raynaud's phenomena, that is blue fingers. So the history how come? The case is that 14-year-old Ali went on mountain trip where there was snow. Suddenly he became pale, faint, fingers blue. He is known case of migraine on treatment. Take history from him. Now how we can take the history? So introduction is similar, we all know that. Then the OCD onset, when it started, how long it going, and is there any triggering factor that increase or decrease, we will ask. Is that it affected the all fingers or not, unilateral or bilateral, any other color changes, pins or needle sensation, we will ask. Then other concerns, is there any dysmorphic features of this and any chronic disease present on the patient, we will exclude. On systemic review, you ask the musculoskeletal systems, any skin spots, lumps, neck swelling, dilated vessels on the face, muscle pain, bone pain, joint pain, hair, nail, finger swelling, everything we will ask. Then FWASL plus activity. We know that FWASL, that is fever, weight history, activity, sleep, and any lymph nodes or lump plus activity. That patient is now active or not. What is he facing? We will ask. From CNS, we ask any fits, any abnormal behavior, seeing something not real, like hallucination type. Vision concern, red eye, abnormal gait and hearing. Chest, we will ask about the pain and in recent bug infection, we ask. From CBA, any concern regarding heart racing and fainting, we will ask. GIT, we ask the tummy size, pain, throwing up, poo, oral soreness, swallowing problems. We will ask from that GIT. Urinary system, we ask the P, flow the urine and blood pressure. Hematology, we ask the pallor, bruising, bleeding and bug infections. From endocrine, we ask the thyroid, Addison, celiac and diabetes mellitus. Past history. Now past history, we know that is a 5T IOA. 5T, that is mean treatment history, any past, any trauma, any traveling history, any blood transfusion, and which team is involved in the treatment. IOA. The past history, the investigation, what they did, what was the onset, when, and the admission needed or not, we ask. And drugs. If he is taking any drugs, any follow-up chronically, any previous disease, we will ask that. Now about the perinatal birth history as usual. Puberty history, we ask the child that smoking, alcohol, OCP. So our case is 14-year-old child. Usually we can ask that smoking started, alcohol or OCP or not. Now VAND plus growth charts. VAND we know that shortly, that is vaccination history and allergy history, nutrition history and diet history. We will ask development history, D4. Then family history will ask all member and any medication modifications they do for this disease, plus family history of migraine presents or not, we will ask. Social history we ask and psychological history we ask as usual. Now I am discussing the Raynaud's type, that is primary disease and secondary phenomenon. Primary disease usually no cause, less severe, needs no treatment, where secondary phenomenon it is associated with a cause like autoimmunoscleroderma, SLE, RA, rheumatoid arthritis, immunoglobulin A nephropathy and Sjogren, post-COVID, injury to hand and foot, vibratory jobs, example drilling machine. Some drugs, example migraine treatment. Look, our history I told that he is suffering migraine treatment. So migraine treatment can be go for Raynaud's phenomena. And OCP, BB, chemotherapy, cold medicines containing pseudo ephedrine. Some chemicals, smoking and excess caffeine. Now clinical pictures. Clinical pictures of Raynaud's phenomena, enough for diagnosis, plus minus dermoscope to examine blood vessels. First, the finger become pale, then blue for short time, then increase blood flow to the fingers. That is red, numb, burning sensation, pins and needles, and difficult movement. What are the treatment we give in Raynaud's phenomena? That we give keep your hands in warm, regular exercise, decrease smoking and decrease caffeine. Avoid the OTC, that is containing pseudo ephedrine. Avoid stress. Nifedipine, that is calcium channel blocker. If severe, surgery to cut the nerve to the blood vessels. Treatment of the primary conditions. So when to see the GP for treatment? When we go? If severe interference with the daily activity, worsening the symptoms, unilateral, child less than 12 years of age old, associated with joint pain, skin rash or muscle weakness. So this is all about the Raynaud's phenomena or blue finger history. How can we take? And please notice the comment sections. I also sent some information about this Raynaud phenomena. Please do subscribe and share. MRCPCH with Dr. Emma Choudhury. Thank you.